as a medical doctor, it's in my opinion that the data exists to show that masking is one of the most important things that we can do, and it absolutely curbs the spread of COVID. And that's an important thing because I've had a chance to study COVID, and I know more than anyone else, because I'm a researcher, just how important prevention is. It's just like cancer, heart disease, diabetes, anything else. We want to avoid this if we can. And so for right now, masking is, to me, a second nature thing that we got to do. It's kind of like brushing your teeth before you go to bed at night, or when you get in a car, putting on your seatbelt or stopping at the stop line. Is just simply one of those things that keeps everyone safe. These are the comparison of blood vessels in the lung. Now, on the left, you can actually see what a healthy lung looks like. There's blood vessels that are there, and they're beautiful, lacy blood vessels, and they're wrapped around an air pocket. And on the right, you can actually see is after COVID-19. This is a respiratory virus that's infected the lung, and you can see how it completely changes the lung. It's not a very pretty picture. Now, I do want to emphasize that these changes are in the lungs of people who had severe COVID and died. And even though we looked at every patient and we found this in every patient we examined, it's really too early to say for sure that everyone who gets a coronavirus is going to suffer from these changes. But this is actually part of what we're learning. This is something we all definitely want to avoid.
Now we're going to talk about masks, since we know that we still unfortunately need to be wearing them. And yes, everybody's sick of it, of course.
This is actually a study from Duke University, so one of the great universities of our country. And they published a study taking a look at which masks were most effective to protect us. And surprisingly, they also took a look at which masks actually don't really work at all. So what I want to do is to walk you guys through, 3 masks that work and 2 that don't work really well. This study actually looked at the fitted N95, which is what healthcare workers actually have. And in the beginning, this is what we all heard about, is the N95. And it's not surprising that that's one of the best, because that's what healthcare workers use in the hospital to stay safe.
That gives them their badges of honor on their faces.
That's right. You got to have it fitted. It actually seals around the face. But here's the deal. You don't really need to freak out about trying to find one of these things, because they're still being reserved and saved for our healthcare workers. The KN95 is actually more available. They're not exactly the same. They're pretty good. But in this study, the next best mask to the KN95s and N95s actually are the procedure masks. Now, these are pretty easy to get. And the important thing about these is they're also surgical masks. They're what your dental hygienists wear, so they're comfortable. You can wear them all day, and surgeons will wear them for hours. I'll give you a little orientation. There's a top and a bottom, and the top actually has this wire bridge. Right. When you wear it, bend it around your nose, just like this. This is how you fit it. You put it on your ear. Get a really good shit.
Pull it down over your chin.
Pull it down over your chin. Okay, really comfortable to wear. And the thing is that we've got the data that this actually works. It's pretty good. It's the next best thing to an N95. And the key thing is that these are easy to get. They are single use only. So when you're done with them, you just toss them out. This research from Duke University actually showed that polycotton masks, like the one you have, are equally effective as the procedure or surgical masks, as long as they have 2 or 3 layers. Now, 3 layers are better than 2. And I have one right here. You can see there's a front layer with blue, and there's a white layer in back. There's another one on the inside. 2 layers is just fine. You don't need to add a filter. They're really comfortable, they're convenient, and they're washable. So I want to show you 2 masks that kind of flunk the test, is what I would call it. And one of them is something that we've all seen, and that is the bandana, right? We've seen people walking around with these, right? And what they actually found is that wearing a bandana is definitely better than not wearing a mask, but it's only a little bit better than nothing at all. So not that great. So when I see somebody wearing a bandana, I sort of step away. It's just not a good one. But there's a worse one. And the worst one, actually, surprisingly, is this. We've seen these before, the neck gaiter.
Is it worse than wearing nothing?
It's hard to believe, but that's actually what they found in this published study. And the explanation is that the shape of the gaiter allows respiratory droplets to actually become finer. And then the shape of the gaiter allows these droplets, the finer droplets, to spray out in the air, which is worse than not wearing a mask at all. And can I just leave your viewers with 3 things? 1, it's so simple. Wear a mask. It's going to protect you and protect other people. Number 2, keep a safe distance. And number 3, wash your hands.